Just wanted to welcome you all to the Arkansas Counseling webinar. And this is Dr. Krista Nelson. And today she's going to be presenting to us. Dr. Nelson is an associate professor of psychology at Southern Arkansas University. She is also a licensed professional counselor. And Dr. Nelson, thank you so much for being with us today. I'm going to turn it over to you, okay? Awesome. And I'm actually going to see if I can't share screen here.
Okay.
Oh, let's see. Here we go. There. I think you have it now.
We do. Is it showing up now?
Well, I just turned it over to you, I believe. There you go.
There we go. I see it now. It says that it's there. I did want to correct. I wish I was an associate professor. I'm only an assistant.
Oh, I'm sorry.
No, it's okay. I go up for tenure this in January, February. And so I'm hoping to become an associate, but I didn't want it to get back to my supervisor that I was maybe, posing as something I'm not. But anyway, welcome. I hope I find all of you happy and healthy. Today, we're actually going to be talking about fear of failure. It's actually one of my research topics, and it's actually something that I've done. I actually had it as one of my components for my dissertation, so it's something that I find very interesting. It ties in, if any of you have interest in imposter phenomenon, there is actually some overlap, and so we'll kind of touch on that briefly. So if y'all don't mind, we'll just kind of get started. I am a little nervous. This is my first time to do a Zoom presentation like this. We've been live streaming at the university, but I apologize if I do something incorrect. I just want to give you that advance notice. So anyway, here we go. Let's get started. Okay. And it's not. Okay, there we go. Some of the definitions of fear of failure. I actually looked into this with my dissertation, as I mentioned, and know that it's a pretty wide range when we talk about fear of failure. One definition can be identified as like having fear, being motivated to avert or prevent failing. I think we've all had situations in our life where we've been worried about something and we maybe did some overlearning to make sure that we accomplished a goal. The problem with having true fear of failure is sometimes these individuals will, if you experience it, you may actually have, the fear becomes debilitating, and you actually have difficulty overcoming this fear in order to accomplish a goal. Atkinson, back in the 60s, actually identified fear of failure as a disposition to avoid failure, and it has a capacity, there's a shame or embarrassment component to it. You'll hear a little bit more of that in the future, but what basically this type of fear of failure is that it, it is this fear of being unsuccessful to the point that sometimes it just limits your behavior and you may not even start trying to accomplish a goal. And if y'all have questions, I think there should be a chat bar. Feel free to chat and I can answer them at the end, or let me know. I'm trying to find it on the screen.
Yeah.
Okay. Let me get back. Did I skip a screen? I think I did. Sorry about that. I can't get this to close. There we go. Sorry about that, y'all. Oh, I didn't mean to do that. Okay, hold on. It's not wanting to cooperate. There we go. Okay, Atkinson, I'm sorry, y'all. He did a lot of work, if you are familiar with achievement and motivation back in the 50s and 60s. And in 57, he came up with the actual definition that fear of failure is defined as avoidant motive, which is aroused by debilitating anxiety. Now, as clinicians, we understand how detrimental anxiety can be. That being said, we need to be aware that this may be something, I look at it, I actually have private practice on this side, But as a professor, we know that fear of failure, it can actually be a problem for our students. And so that's something we're looking into. There's been a lot of research in educational and vocational settings. I'll get to that a little bit more. And so understanding that individuals may have this fear of failure can be something we as clinicians need to consider, because it may be limiting them, especially if you have any interest in doing like career counseling, having the individual do problem solving or setting particular goals. If they have some of this fear of failure, it could be setting them up for problems in achieving those goals or living their best life. Excuse me. Sherman, back in the 80s, came up, he basically said, it's pretty simple to say, but fear of failure is this fear of not attaining a goal. Now, how many of us have actually at some point said, hey, I really want to do X, Y, and Z, but I'm just afraid to start? And that debilitating kind of attitude, or having that really deep fear, can set us up for, it's not even failure if you never start, but it's that fear of failure that keeps us from initiating maybe towards a goal. I at one point thought I wanted to be a medical doctor. And I know we all have similar situations where we have stories like this, but I got to organic chemistry and realized that maybe organic chemistry was the reason that I did not want to be a medical doctor. And so I dropped the class before I got a bad grade in it. And looking back, I mean, I'm happy with my career choices, but I have wondered if I had just shouldered through. I was so fearful of losing scholarships or, getting a bad GPA, that I dropped the class before I allowed myself to actually really perform. And so then I changed my major and went into psychology. And so that fear of failure, having this fear of not reaching or attaining a goal, kind of, it changed my career path. It worked out, but it could have been a whole different career that I'm in. We have other researchers who have identified fear of failure as a tendency to appraise our threats, and then does it cause anxiety during situations that create that possibility for failing? Knowing that, having that fear that you won't be successful could be something that is frightening your clients. It could be I know we see it at the college level. My advisees in particular, I had a situation recently. We have a class that's it's a required class for graduation. And it's a science class. It is human genetics, and it's not an easy class. Fortunately, we have some great professors who teach it, and they're very willing to work with the students. But I had an advisee recently message me and said, I need to drop the class. I'm afraid I'm going to do poorly. And I had to, I call it walk them off the ledge, that, you have an excellent GPA. Their biggest concern was not only losing scholarships, but I don't think one C would have potentially lost a scholarship, but their biggest issue was they're wanting to apply to graduate school, and they're afraid a C on their transcript would keep them from that performing well enough to get into graduate school or having the GPA. So we talked about it, but that's just one small example of how having this fear of a bad grade in a class can actually make you want to drop. And it's something I dealt with just a week and a half ago with a student. So the fear of failure, this fear of not being successful, you can see how it could be problematic if we have people who are maybe making life changes in career goals, or even think of it this way, our interpersonal relationships. We have individuals who are maybe considering life changes, big life changes, career changes, educational changes, relationship changes, maybe thinking of divorce, but they're fearful that people will consider them a failure. And so maybe they'll stay in unhealthy relationships because it's too scary to be there on their own, because they're afraid they may not be successful. When in looking at, hey, maybe this is not working out, and we can think about how our future could be maybe a healthier relationship, or when you're just in a less toxic environment. Some of the history of fear of failure. Basically, in the 50s and 60s, I mentioned this, Atkinson was looking at achievement motivation. Motivation was very popular at that time. That's part of our humanistic kind of period in psychology. That's when we had Maslow's hierarchy of needs, and we also were seeing some of Carl Rogers' work coming out. And achievement motivation was something that was being examined. Atkinson, he thought that fear of failure was a psychological theory that could come out of his achievement motivation kind of work. Now, during the 20th and 21st centuries, the models of fear of failure and achievement motivation, they're really popular right now because there's so many different aspects that they can influence. You'll notice that I have Conroy, Metzler, and Hoffer. Actually, you'll see the name Conroy a lot. David Conroy he's actually an exercise physiologist now, but he did his doctorate in he created an instrument. We'll talk about it in a little bit. And that instrument has kind of been embraced by the psychology field, even though he used it for athletes. It was originally created for athletes. I've developed a relationship with Dr. Conroy. He actually did it as his doctoral dissertation, making that instrument, but it works really well for fear of failure in psychology as well. I've been fortunate enough, he's given me permission to use it anytime I want. He just always wants to be noted as the author, obviously. And so he's very easy to work with. So if you ever have interest in maybe using that instrument, if you're looking to see if you think maybe someone has some fear of failure issues, I'll give you my email address at the end, and you're more than welcome to contact me when I can give you his contact information. Anyway, what he kind of did this study on how athletes have performance fears, particularly this fear of being unsuccessful, like if they get up to bat in a baseball game or they don't perform well in football. And so he did this whole dissertation on this. And then after he did a few studies with it, like 7 or 8, he decided that was not something he was interested in anymore. So he actually doesn't do research in that topic any longer. In the 60s, fear of failure actually became a construct of achievement motivation literature. It became more seen in that literature in the 60s. And since then, it's been postulated to serve several different functions, kind of like I mentioned. I got that information from Conroy, but we've seen that it really correlates with several different types of topics. One of them being self-efficacy. We'll talk about that in a little bit. I mentioned imposter phenomenon, obviously some other pitfalls that can be detrimental, including self-esteem, self-efficacy, but we'll get to that in just a second. I'm sorry, I noticed the time and it seems like I'm kind of rushing. And so if I'm going too fast, please do a question and answer and let me know. Like I mentioned, I'm a little nervous, so I apologize. We do know that recent research has actually suggested that individual fear of failure is directly related to having those anxiety feelings, but also an appraisal of threat. So if the individual feels as though someone has power over them or they could lose something, that appraisal of threat that they will somehow be harmed, maybe not physically, but it could be your GPA, or the feeling that you could be, maybe lose a scholarship, I mentioned that, lose a relationship. They've actually done research that has identified that women in particular seem to have fear that if they are unsuccessful in something, their partners will kind of lose interest in them and they will not be seen as like competent and successful. And so that fear of failure will oftentimes make them not attempt new endeavors because they're afraid that they will be identified as, not being successful. And that can actually interfere with their interpersonal relationships also because they're fearful their significant other may look down on them. We do know when we have this appraisal of threat, if there is a possibility of failure, what happens is people will avoid the activity or the obstacle that they consider because they are fearful of having these feelings of shame. And they'll also sometimes will report feelings of degradation. And so to prevent any of that from happening, again, they'll just kind of fall into the, hey, I just won't even attempt it. And so they sometimes fall into areas that are maybe stagnant, or they're in relationships, friendships, employment that they are unhappy with because they're afraid to get outside of that box, because they do have fears that they'll be unsuccessful if they do step outside of their comfort zone. When we talk about fear of failure, as a model, it's argued when two specific processes transpire. First, the individual must anticipate the possibility of failure occurring. So they have to think that there's probably a good chance that they're not going to be successful. Or they have to perceive that failure has already occurred. Secondly, for this model of failure, the individual must believe that failure in the situation will cause or bring about one or more negative consequences. And those negative consequences are very individualized. And a lot of times what might be perceived as a negative consequence for one individual wouldn't be problematic for another individual. And so we have to take into account, particularly as therapists, which we're all trained to do, is that what seems problematic for one person, to us, it may not seem as severe, or it may not seem as severe to someone else. But it's not important what we as individuals think, because we do know that it's very individualized, and what can be problematic for one person isn't maybe a problem for someone else. We talked about anxiety briefly earlier, and keep in mind that fear of failure, there is a strong correlation with the development of anxiety. Clinically, we know how debilitating anxiety can be. When this anxiety gets so overwhelming, oftentimes the individual will not try to attempt a goal. If this anxiety persists, we may end up with individuals in our office having generalized anxiety disorder, or even a phobia, social phobias. And so to take into account how significant fear of failure can be on the development of anxiety is something we need to consider. And also, when we have these individuals coming in reporting anxiety feelings, maybe assess to see if that fear of failure is a component. The more we know about what is anxiety provoking for the individual is always going to be better when we look at our clinical diagnosis and look at prognosis and treatment as well. And when we talk about the anxiety, we also have to consider that shame can be a significant component involved with the development of anxiety from fear of failure. When we talk about fear of failure, we need to know that it can be a form of anxiousness regarding our performance. I don't know anyone, well, there are some people I know. I had some anxiety today about presenting. This is my first time to do a Zoom presentation. It's different in the classroom because I'm perceived as the expert there. It's my classroom, but to do it in front of colleagues, that's very anxiety provoking. I wouldn't say that I had fear of failure, but there is that. I did have some concerns about getting Zoom to work, particularly like the shared screen. So you can see even professionals can experience this. This is not something we're only going to see in high schoolers or college students. We have situations where we may have anxiety or nerves that are based on how we perform. Today was a prime example of when, I've had some of those jitters and some of that anxiety. We do know many researchers explicitly include the idea of shame in their definition. And let's think about that. If we have someone who is experiencing shame, that shame is that maybe they are bringing embarrassment to themselves, embarrassment to their family, to their colleagues, to their supervisor, their significant other. And so many researchers now do include that component of shame when they create their definitions for fear of failure. It's kind of seen as a unfortunate side effect when you do start developing the anxiety from the fear of failure. If you don't mind, I'm gonna take a drink real quick. Sorry. Now, if we have someone that we mentioned having the shame, the anxiety, keep in mind that fear of failure is essentially fear of aversive consequences. Now, some of the aversive consequences could be anything we've already mentioned, maybe a poor grade. It could be losing a scholarship. We've mentioned those. But what are some other aversive consequences? They may be vastly different for each individual. While I don't think anyone would want to lose a scholarship, the idea that your significant other might be disappointed in you or embarrassed by you, one person might distinctly feel some of that depending on their levels of self-esteem, their confidence in their relationship, where you may have another person who has no concern about that at all. They feel very accepted in their relationship. And so individuals that believe those aversive consequences are going to occur, they are usually more likely to experience that feeling of threat, and particularly in situations of evaluation. So think back in, everyone here are professionals, let's think back to graduate school. And you had maybe your first opportunity to present to the class, your mock therapy that maybe you've done it, maybe you recorded something or showed a video. And think back to the anxiety you may have felt knowing everyone is watching you and your professor is evaluating you. It can be very overwhelming. Imagine if you live with that fear every day, that you're not going to be successful. And there are some individuals who actually do experience that level of anxiety on a daily basis. And that would be very hard to live with, and it would be very uncomfortable. Now, because of that fearing failure, many individuals are going to try to avoid that shame, and they're going to do this by avoiding specific circumstances. So if you have a concern about a test coming up, these are the students who may feel sick at their stomach and not be able to go to class that day, and so they miss their exam, so their grade plummets. Because often professors are pretty strict if you don't have maybe a doctor's note to show that, hey, you really were sick. Now, I think now in COVID, everything's a little bit more lax. I know my classes are, if they feel bad, I'm like, don't come, just zoom in, because I don't want to spread anything. But that being said, imagine if you're avoiding those circumstances, that you're just afraid something negative could happen. Doesn't mean it's going to. And so you may be avoiding different sports. You may be avoiding social gatherings because you may be afraid you'll embarrass yourself or not be successful in developing relationships outside of your what's comfortable already. This can be tied to social anxiety. And so individuals who are fearful that they will not perform as well in a social situation may not have as many friends. And it may just be that it may not be that they're just a natural introvert. It may be that they want friends, but they're afraid to get outside of this comfort zone and initiate some type of friendship relationship because they're afraid that they'll be judged or evaluated, and that fear of failure kind of kicks in and influences even their ability to make friendships. Now, Conroy, we mentioned him earlier, he actually came up with 5 specific consequences that fear of failure actually is comprised of. These are kind of tied to his performance inventory, and I'll give you a link to that in a little bit. When we talk about the performance anxiety, know that does directly relate to fear of failure. Fear of failure basically has 5 specific consequences, including experiencing shame and embarrassment experiences, the devaluation of one's own self-worth, basically thinking I'm not worthy enough. I'm not good enough to do X, Y, and Z. I'm not going to be successful. So think of how that would wear down on your self-esteem. Having an uncertain future, not feeling as though you are going to be, most of us have specific goals, and we have sub goals that we put with that to map out our future about whatever we're trying to attain. Individuals with fear of failure don't have that specific goal orientation often. They feel uncertain about their future, so they don't want to set specific goals because they're afraid they can't attain them anyway. Losing social influence. These individuals with fear of failure, they're afraid they're going to be looked down on. And so they're afraid to take on new tasks or new endeavors because they're afraid individuals may talk about them or think they are silly, or they'll be shamed about if they aren't successful. And then upsetting important others. This kind of goes back to some of those relationships that they are afraid if they step outside of the box and try a new task, that if it doesn't pan out, then their significant other or their family or maybe their boss, their university would be embarrassed by them or upset with their activity. And so that in and of itself, not feeling like you have that social support, will also, that fear that they would upset someone will keep them from dipping their toe in the sand to try to see what's out there. Now, I mentioned that there are some correlations that are pretty significant between the concept of fear of failure. One of those is self-efficacy. Most of us are aware of what self-efficacy is, theorized by Bandura back. He basically first came out and called it self-beliefs. And the self-beliefs he later changed to self-efficacy. Self-efficacy is defined as those beliefs that we think we have the ability to perform. So am I efficacious in math? Do I feel efficacious working with my clients? Am I efficacious in my ability to play baseball? And so, as y'all are probably aware, there are reams and reams and reams and reams of research on the topic of self-efficacy. Basically, it's often used in the education realm, looking at, do students feel efficacious for their ability to perform well in school? Do they feel like they have the ability to study well? It's used everything from, I actually have a colleague here, he actually just left, but he was doing research with elementary school students. He and another couple of professors were looking at self-efficacy in as young as elementary school. That's because there's so much data that reinforces that the better we feel about our abilities, the better we are going to perform. That being said, knowing that the better we feel, there is a high correlation between fear of failure and your personal levels of self-efficacy. We know that as our fear of failure increases, we have these fears of failing. What do you think that does to our self-efficacy? Yeah, as fear of failure starts going up, we have the inverse relationship where our self-efficacy usually goes down, because we fear if we're going to be unsuccessful, we don't have the ability to perform or do something well anyway. So that negative correlation, basically, that's not a correlation we desire. We don't want to see that relationship. We would actually see that we start to decrease our fear of failure and have our self-efficacy beliefs actually start to increase. But unfortunately, that's not the case. Bandura basically asserted that personal self-efficacy, those views influence how a person is motivated to achieve our personal successes and our achievements. And this in turn actually relates directly to our personal contentment, how well we feel. So the more we are motivated to be successful, according to Bandura, Bandura said that as that starts to increase, that's going to positively impact our feelings of personal satisfaction and happiness. Now, pitfalls. We do know, we've already mentioned self-efficacy, that the fear of failure highly correlated with fear with self. That actually have a typo there. It's supposed to be self-efficacy is highly correlated with fear of failure. We know that the higher the fear of failure, the less efficacious that a person is going to feel. Knowing that, we also have a lot of research that has shown that fear of failure actually relates to self-esteem. Individuals who don't feel confident in their ability to perform well, having some of that performance anxiety or fear of failure, often lack self-confidence. They usually have poor self-esteem, and they are prone to low risk taking. And let's kind of talk about that. It makes sense that these individuals are prone to low risk taking if they're afraid they will be negatively evaluated on their performance, particularly if they feel like they might be unsuccessful. Having that lack of self-confidence, having that lack of self-esteem, feel how they feel about themselves. If you feel like you can't be successful in things and you feel like people will negatively maybe talk bad about you, or, whisper behind your back that you didn't achieve something, that's going to eat away on your personal self-esteem. It's going to make you not be as confident. And so it only makes sense that we see a high correlation between fear of failure, the feelings, and also having some of that low self-esteem, poor self-confidence. And then the low risk taking makes sense as well, because why put themselves out there if they're afraid they'll be negatively evaluated? We do know self-doubt feelings have been researched a lot. Fox did a study back in '94, and they've had several subsequent studies. Actually, part of my dissertation was looking at self-doubt, self-efficacy in terms of vocation, particularly engineering students. But we do know that those self-doubt feelings, which tie directly into fear of failure, they are often can be predictors for career choice. And when we talk about career choice, there are some individuals who literally will avoid I get it, when I told you about the organic chemistry, avoid pursuing some degrees or some educational pursuits for fear that they will be unsuccessful. And so research has been looking at how can we make people feel more confident, have less fear of failure, have better self-confidence, and how can that translate to maybe individuals going into different careers. For example, one of the things I did research on in the past was females in engineering, and I used the performance, it's the PFAI, I'll get to it in a minute. And we know that women often, because their fears of failing, and when they compare themselves to their male counterparts, that impacted their career choice. And that being said, they were more fearful that they would be unsuccessful when compared to their male counterparts, and so wouldn't even take the plunge to try to see about engineering as a career option. And we know if it happens in one career, it's probably happening in all sorts. That people just are afraid that they won't be successful, they won't be valued, they won't be seen as doing their best. And so rather than be evaluated negatively, they just won't even try to pursue that as a career goal. Some more pitfalls that we have about fear of failure. We do know individuals with fear of failure often feel less control of their life, particularly their personal lives. They feel as though they don't have as much ability they don't have the greater ability to make their own decisions. And so they don't feel as though they have that personal control. They also feel less satisfied with life. Now that's scary, because that's how we end up with people needing therapy at some point, because they're dissatisfied in some way. They maybe are dissatisfied in, we talked about career or education. And so that can bring about depressive feelings. So if we have some of that fear of failure, then we may start seeing that lead to more defining mental health issues, certainly issues that mental health problems that are more debilitating. And so that may be something we start seeing in the clinical realm and not just an educational realm. We do know fear of failure also is linked to physical health. Individuals, we talked about the link between anxiety and fear of failure. So fear of failure leading to anxiety feelings, feeling like you're not in control of your life, actually can have negative impact on your physical health. We do know from reams of research on anxiety how detrimental anxiety or stress can lead to problems with your physical health. And research has actually shown that there are links between fear of failure and having more negative health problems. So just the idea of working with individuals with fear of failure to reduce even, some of those health issues is one reason to consider it as a topic. If any of you are in education, or if you have clients coming in that are having some maybe problems with goal attainment, explore what are some of those areas that are influencing those problems with goal attainment or fear of maybe making a change. We do know that individuals who have fear of failure usually have lower grades, and it's going to directly impact what their educational pursuits are. So individuals, particularly, so say I'm a professor and I have students and they have fear of failure, that's going to impact their GPA. And so as an advisor, that's not anything I want, and it's certainly not what I want in my classroom. So if we can get more students, we have a counseling center here that all students can attend. If you're a student at SAU, you're allowed to have as many counseling sessions as you would like. It's free of charge. It's part of what we offer. I know a lot of other universities do this as well. And so this, being able to work with them on overcoming fear of failure, we may see increases in their school performance, which is always a good thing. It's going to help them with their later careers and actually just their self-confidence. They're going to feel better. And so self-esteem is going to go up. So if we can work on improving it, we're going to see advantageous improvements in many different areas of their life. Now, we mentioned education. I know I look at it a little differently since I am a professor. I do, like I said, I have clinical practice on the side. But that being said, we know that fear of failure has been really researched within the educational realm. We've had a lot of studies that have identified fear of failure being a big predictor of our college pursuit, particularly like college major, and also those educational goals. We do know that Shaver back in 76, as early as the 70s, individuals having fear of failure were identified because they had this fear of what their success would be on their educational goals and careers. And so even back in the 70s, it was already being identified how significant fears of failing could be on our future career history, our educational history. And so that taking that, lots of researchers have basically piggybacked and identified ways that fear of failure kind of influences specific topics. We do know that some students actually do avoid college in certain degrees due to the fear of being unsuccessful. I don't know if any of you are school counselors, but think of it this way. If you're a school counselor and you're talking to a student and they say, I don't think I need to go to college. And you say, okay, can you tell me some of the reasons you're kind of thinking college? And I know that college is not for everyone, and I'm certainly not trying to say that. But if you are talking and, if they have legitimate reasons, sure, we understand. Maybe they have a family business, or maybe they want to go into a trade. Certainly, whatever they want to do to be happy. But what if their reason for not going to college is simply that they're afraid they won't pass and they won't be successful. And I would hate to see that someone would miss out on an opportunity to be really successful, simply because they were afraid to try. And so maybe as a school counselor, that could be something some of you look into and see, hey, what are some of the reasons individuals may choose not to go? Or it could be, my daughter wants to be a hairstylist, and she has this fear that she won't be able to give, I don't know why it's kind of focused on this, but perms. I don't even know if people get perms anymore, but anyway, she has this fear that she won't be able to give perms. And so we've talked about that. That's why you go and you get training. Same with college. That's why you go. It's why you get training. It's why we have freshman seminar classes that teach us how to study. And so if we can use that to reiterate to students to try to make them feel more confident and reduce those fears of failure, we'll have a lot more individuals who are more successful and happier. And some of the consequences, when Covington and I'm not sure, Omeliak, I think is how it's said, individuals that demonstrate fear of failure are unsure they will be able to be successful and don't believe in their capacity to avoid failing. They don't believe in themselves, basically. And so that does directly result in lower self-esteem, and it kind of points to having low self-esteem. They don't believe in their capacity to avoid failing. And so as a clinician, if we see someone with those feelings of low self-esteem, if we can increase one, feeling that they are not going to be failures, and also feelings that they are maybe have less self-doubt and better self-confidence or self-esteem, that's only going to, it's going to positively correlate with if we can kind of increase how you feel about yourself. The chances are you're not going to have those fears of failure as significantly. So individuals who have fear of failure, we don't want them to avoid those situations. We don't want them to avoid opportunities for trying new things, but unfortunately they do. They basically set themselves up to be unsuccessful because they don't ever actually attempt the goal. And that's kind of sad, and we want to help them with that. We want them to be able to work through some of those consequences, some of those potential worries that they have that they will be unsuccessful. We do know that I'm not sure if any of you are familiar with the imposter phenomenon. The imposter phenomenon is a sense that someone has low self-concept of themselves and they feel that they are maybe only successful because of maybe they knew the right person or luck intervened and they just got lucky. Hey, I didn't really deserve to be accepted into that PhD program. It was just luck, or I just knew the right person and they said something good for me. They don't ever take credit for their actual accomplishments. They don't feel they deserve them. They fear that people will find out they're an imposter. And they worry that people will find out that maybe they're not as good as maybe their credentials say. This was originally done by Clance and Imes. They started looking at research in the late 70s and 80s and identified that even women with wonderful degrees or wonderful jobs and in the business world who are very successful feel that they got into that role without actually, they shouldn't be there, that they just lucked into it or they knew the right person. And if anyone found out their true inner capabilities, then they would be found out to be a false or a fake or an imposter. So that is what the imposter phenomenon is. We're hearing a lot about that now in media. Several famous actresses have come out saying that they experience some imposter phenomenon themselves. And that being said, one of the main components of the development of the imposter phenomenon is having this fear of failure. So we know that fear of failure is going to correlate with the development of having the imposter phenomenon. that negative, having that experience that I'm not as good as my colleagues, and comparing yourself to your colleagues and worrying that you'll never measure up. That's not healthy, obviously, and it kind of it relates significantly to having low self-esteem. So Clance and O'Toole back in '88 even came out and stated that fear of failure is actually an underlying motive for the development of imposter phenomenon. So for those imposters that make mistakes and not performing at what they consider their optimal level, that's going to bring about shame and humiliation. So it's kind of one of those, we have fear of failure that precipitates and likely assist in the development of imposter phenomenon. And then the two together both can bring about those feelings of shame and embarrassment, humiliation if they don't perform the way they should. And so they're very intertwined. And so that's another whole topic, but it can see how if you have that fear of failure, it could bring about the further development of having the imposter phenomenon as well. I mentioned David Conroy and the fact that I use his scale. One of the things that he uses, he created this scale as a measurement of fear of failure on a multi-dimensional level, developed to measure beliefs that an individual has about certain and specific adverse effects of failing. And the PFAI, because it's the Performance Failure Appraisal Inventory, it looks at 5 components. We talked about these earlier, but it does test for component of embarrassment and shame experiences, diminishment of one's self-worth feelings, feeling uncertain about that future, perception that significant others have kind of lost interest in them, and belief that significant others will be angry or upset if they are failures. So again, if you're ever interested in kind of assessing to see if you're especially if you're wanting to do research in fear of failure, if you'll contact me, I have Dr. Conroy's email information and can send you some articles that he originally did about this instrument. And you can just email him, and he always gives permission for you to use the instrument. He's very enthusiastic about it too. So he's kind of nice to email with. Now, when we talk about fear of failure, what do we do for it? How do we help it? When you have someone come in, maybe assist them in examining their fears. Are those realistic fears? You know, do they just have fear that they're going to get a bad grade and so they're going to drop our class? I wish I'd had an advisor back eons ago who had maybe talked me off the ledge and said, hey, you know, one grade is not necessarily going to make or break your career. That being said, I mean, if it's a realistic fear that you could be injured or something like that, I mean, sure, we need to examine that, but examine those fears. Are they even realistic, or are we just afraid we'll be negatively evaluated based on our performance? Take stock of your success. So when many therapists are CBT, so we're talking with them and we're assessing, you know, are these even realistic fears? But maybe we need to assist them in remembering some of their successes, because I think some of us, maybe all of us, get into the habit of just seeing what we haven't done well. And so we forget that, oh, yeah, I'm pretty good at that. Or, yeah, I need to remember that, hey, I'm really successful when I do X, Y, and Z. So it could be parenting. Someone's afraid they're failing as a parent. And so you show, maybe through therapy, you help them remember how they've been successful at parenting. Maybe this is just a rough patch and the child is having some acting out. That doesn't mean that you're a bad parent. Work with them at identifying what some of those successes are. Look in an accurate mirror. And what I mean by that is, if you have someone who is really experiencing this fear of failure, have them look accurately at themselves. And what I mean by that, by an accurate mirror, is sometimes we look in the mirror and just like with body dysmorphia, you see something that really isn't there. Sometimes when we're thinking about our capabilities and our strengths, we forget some of those. And so we need to look accurately at what we are good at and not just let the negative impact our decision making or how we feel about things. Don't suffer. I'm sorry, I skipped one. Find a mentor. If you have, see, this may be more appropriate in an educational realm, but you could maybe use it in therapy as well. But maybe find a mentor who can kind of walk them through about an easier way to be successful. You know, I have a mentor that she's younger than me, but she's the smartest person I know. And so if I have research concerns, I call Janelle. That's her name, Dr. Janelle McDaniel. I ask her, how should I proceed with this? And so she's great with helping me be successful. And so if you could find someone or encourage someone to find a mentor that will help with some of those successes, we can start to reduce some of those fears of failure, because we'll see how we're improving or how the individual is improving. Don't suffer in silence. As clinicians, we know the value of talking about our feelings, talking about what we're experiencing. And so if we can get our clients in, if we can get our students in to come and talk about what they are experiencing, that way they're not just, you know, having all this ruminate or bubbling up inside. If they can be talking about what their fears are, we as therapists know that that's only going to benefit them. Have a sense of humor. What I mean by that, we all make mistakes. None of us are perfect. And so sometimes you just have to say, my bad, I screwed up, or maybe I should have done this differently, and just kind of laugh it off if you can. Or maybe have the ability to laugh at yourself if you do make a mistake. And sometimes it's easier to laugh at yourself than listen to anyone else maybe criticize you. And so if you can have that sense of humor, it can maybe help you be more willing to accept if something happens and you do have some negative criticism. And then finally, if you can find the life you really want, and that may be that you have to go outside your comfort zone. And for people with fear of failure, that may be painful. That may hurt a little bit. But if you can encourage them to step outside of this comfort zone and seek out whatever it is they're trying to attain, a new relationship, a new career, maybe getting into a different degree program, graduate school. That's the one I have a lot with my advisees. And if you can help them decide what that is that they really want, find that life you really want, and then assist them with how to maneuver those potential pitfalls, but be willing to try, even if there is a potential for being unsuccessful. That is only going to increase the likelihood that their life is going to improve. So any way we can try to reduce those fears of failure, try to get people outside and trying new things, that's only going to improve their self-esteem when they are successful and make them feel better about themselves. So I also listed some references. There's quite a few here. I've got 2 pages of them. If you have interest in these PowerPoints, you're more than welcome to contact me. I should have put my email here. I didn't. But my email is just my name, Krista, Krista Nelson @saumag.edu. If you would like any references or any follow-up on this information or even imposter phenomenon, it's one of my areas of expertise as well. And if anyone has any questions, please let me know.
Let's see. Okay, there we go. Well,
I see there's a couple of chats. Okay, sorry.
Oh, okay.
I'll put my email right here.
I was going to say, there we go. Perfect. Yeah. And so, yeah. And I know that some people might have asked or whatever if there was a way to get the PowerPoints. Obviously, they can contact you.
Yes,
sure. You can send that to them directly.
Certainly.
Okay, great. Appreciate that, definitely. And thank you so much.
Well, thank you for being here. I'm sorry, I didn't mean to interrupt.
No, you're fine. I wanted to remind all those that had attended too that right after we end this, there will be an automatic link to the survey so you can obtain the CEUs for Dr. Nelson's presentation. And once you've completed that, then you should also automatically get a response with your CEU certificate. If you have any questions or concerns about that, you can contact myself or the Arkansas Counseling Association's on Facebook or our email. Thank you again so much. That was a wonderful presentation. I hope everybody enjoyed themselves. Looks like there's a couple more questions here, as a matter of fact. Yes, there is to Colin Davis. Yes, there is a CEU for today's attendance. For those who are attending live, you receive one CEU. If you are viewing this on the recording, you just are able to get the education, but not the CEU. Regardless, the Arkansas Counseling Association is going to continue bringing you guys these live webinars and everything monthly. We're fortunate that we have individuals like Dr. Nelson that are going to be doing presentations for us. And so let's see here, any others?
I just want to thank you all for attending. I appreciate that y'all took some time out of your day, your lunch hour to stop and listen. So I appreciate that. So.
Does anyone else have any questions at this time? Well, then thank you all for stopping in and being here today. On behalf of Dr. Nelson and the Arkansas Counseling Association Board, we thank you, and I hope everyone is staying safe, healthy, and, be kind to one another. I know everybody is going through these uncertain times, so reach out, do what you can, and again, thank you so much for attending today. And as soon as we end the link or in this webinar, there will be an automatic link that will pop up for you. So we're going to end here in about 2 minutes because Dr. Nelson did a great job of being on time. And so we do have like 2 more minutes if anybody has any questions. Otherwise, I don't know. Well, hey, it's the middle of the week and we've made it this far. So I'm actually going to go ahead, and if no one has anything further, we're going to close it out so that survey can go ahead and be sent and you'll be able to get it. Okay. So thanks again. And don't forget to register for our next webinar. It will actually be this coming Friday. That one is on ethics, ethical presence over protocol, I believe. And so it will be an ethics CEU with Dr. Benjamin, and I'm going to say his last name wrong. I believe it's Okai. And so we look forward to that on Friday. And have a great afternoon, guys. Thank you.
Thank you.